Alright guys, so we'll talk about the porphyria. Porphyria. I don't know if I should actually use this right. Porphyria. So these are the different types of porphyria. So this is like an overview lecture. You understand? It's more of like introduction to porphyrias because before you get to understand porphyrias in depth is when you now talk about each one of them. You understand? Talk about each one of them. Right. So they're actually a group of inherited blood disorders caused by abnormalities in the production of heme, which is a component of what hemoglobin. Alright. So these disorders result in like there's a buildup of natural chemicals known as porphyrins. You understand? Or in other way around, you now say that what the materials that are supposed to haven't been processed to form heme, they are not there. Do you understand? So there's like they are probably the ones turning into porphyrin. So there's accumulation. You understand? So for the types, you have the acute porphyrias. Alright, this one symptoms like abdominal pain, chest pain, confusion, constipation, seizures, all of them acute. So it's quite quick. Right. The types you have the acute intermittent porphyria, variegate porphyria, hereditary coproporphyria. The cutaneous one, this one usually affect the skin and cause sensitivity to sunlight, leading to this painful blisters, swelling, redness when the sun exposed and all of that. Now the Porphyria Cutanea Tarda, erythropoietic protoporphyria, congenital erythropoietic porphyria. Okay. So what is the causes? It's mostly due to genetics. Alright. Sometimes it could be that the enzymes that are supposed to be there, okay, to basically help in the production of heme, they're not there. You understand? So, but it can actually have some triggers. You can have this problem, but the sleeping dog is lying till you encounter any of these triggers, right? Like sunlight, certain medications, alcohol, smoking, hormonal changes, fasting, stress, and all of that. Diagnosis is just blood urine test just to access for the levels of these porphyrins that we spoke about and their precursors. So management is there's no cure, alright? But you just have to be managing the symptoms and all of that. Okay. So avoid sunlight exposure. Basically just avoid any of these triggers that we spoke about. Alright. Avoid any of these triggers that we spoke about and all of that. Okay. Or probably can do an enzyme replacement therapy. Okay. Alright, so that's it for the porphyria.